This is WFYI News Now. It's September 4th, and I'm your host, Abriana Herron. On today's show, a look at the current landscape of virtual schools in Indiana. A federal judge rules that the FSSA is required to provide necessary services for 2 medically complex children. And we'll hear about efforts to help pregnant people get access to prenatal care in rural areas.
It is a standardized process to get patients to get early prenatal care in the first trimester.
Those stories are coming up, but first, an influential figure who led with integrity and civility. That's how the late Richard Lugar, Indiana's former U.S. Senator, was described at a ceremony dedicating a statue to him in downtown Indianapolis. Some of the state's most influential leaders from the past 2 decades were on hand. That includes former Vice President Mike Pence, former Governor Mitch Daniels, and former U.S. Senators Joe Donnelly and Dan Coats. Former U.S. Secretary of State Condoleezza Rice delivered the keynote address at the ceremony. She lauded Lugar for making the world safe by leading the destruction of nuclear, chemical, and biological weapons in the former Soviet Union.
This humble son of Indiana was also an innovator, and he was a creator, and he was a problem solver.
Lugar served as Indianapolis mayor when the state combined city and county government in the capital city. Current Indianapolis Mayor Joe Hogsett says his predecessors set a standard of service for all politicians.
It is my fervent hope that this statue embolden others to do exactly the same.
Lugar served in the U.S. Senate for 36 years. He died in 2019. What is the landscape of virtual schools in Indiana? One of our listeners inspired this question. Indiana Public Broadcasting's Kirsten Adair reports online school looks different for each student, but can have more flexibility than traditional brick-and-mortar school.
Christy Lucarilla's daughter, Raylyn DeVries, attends first grade at the Indiana Gateway Digital Academy. Lucarilla says Raylyn is thriving in online school.
She has been excelling in areas I didn't even think that she would excel in.
After she eats breakfast and brushes her teeth, DeVries goes online, checks emails from her teachers, and jumps into her classes. She follows her schedule until she finishes her work or it's time to log out for the day. The INGDA sends DeVries everything she needs for class, including magnets, goggles, and test tubes for science. Lucarilla helps her daughter with the lessons.
It's really nice to be, hands-on with it and to be one-on-one with her because she gets more of an understanding.
Lucarilla and virtual school officials say parents play a large and vital role in their children's online education. For Indiana Public Broadcasting, I'm Kirsten Adair.
A federal judge ruled the Family and Social Services Administration is required to provide necessary services for 2 medically complex children who were affected by the changes to the attendant care program. As Indiana Public Broadcasting's Abigail Ruman reports, the injunction was modified because of concerns that it could endanger Indiana's Medicaid program as the lawsuit moves forward.
The lawsuit filed in May said the state has failed and continues to fail its duty to provide necessary care to medically complex children. The parties in the case agreed the plaintiffs could continue with attendant care provided by a legally responsible individual, such as a parent, until September 1st while the case is being considered. The plaintiffs argue without the extension of that relief, the 2 children would likely need to be institutionalized to meet their care needs, which violates federal law. The judge says the family's lawsuit is likely to succeed, but striking down the changes to the program for those 2 families could endanger Indiana's Medicaid program. Rather than the parents being able to continue to provide attendant care, the judge says FSSA will have to take an active role in making sure the plaintiffs have in-home skilled nursing and the parents are reimbursed through the state's new program. For Indiana Public Broadcasting, I'm Abigail Ruman.
And for our final story today. An important aspect of lowering infant and maternal mortality rates is connecting pregnant people to prenatal care earlier, but that can be difficult in rural areas that are considered maternal care deserts. A hospital on the edge of Indiana's largest obstetric care desert created a clinic to remove at least one barrier to that care. Union Hospital in Terre Haute serves at least 5 counties and is the only Level 3 certified perinatal hospital in an almost 80-mile radius. Due to limited numbers of appointments, the call center needs to confirm pregnancy before scheduling a visit, but patients aren't always sure how to go about that. Ashley Coleman is a registered nurse who helped start a clinic to confirm pregnancies for patients. She says the clinic also allows them to schedule patients for an appointment based on how far along the pregnancy is.
It is a place that we thought that we could get all patients established in care. It is a standardized process to get patients to get early prenatal care in the first trimester.
Coleman says the clinic has a nurse practitioner and a perinatal navigator to help people navigate care while they wait for their first appointment. That's all for today's episode of WFYI News Now. Our podcast is produced by Drew Daudelin, with support from the news team at WFYI and public media journalists across the state. Our news director is Sarah Neal-Estes. Kendall Antron produced our music. And I'm your host, Abriana Herron. If you like today's episode, remember to subscribe and share. And follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.